Good afternoon, everybody, and welcome to this showcase event for Healthwatch Nottingham and Nottinghamshire. My name's Sarah Collis. I'm the chair of Healthwatch Nottingham and Nottinghamshire, and it gives me such great pleasure to see so many people that have joined us here in person today at Nottinghamshire Deaf Society, and also online as we're broadcasting live. So welcome to everybody that's joining us on the internet. Just a little bit of housekeeping before we start. First of all, we are recording this afternoon's event, and if you have any questions, please can you keep them to the end. If you're online, you can pop them into the chat box, and you've all been given something to write on here in the centre, and we've got an Ask It basket for you to put your questions in, which we'll then look at during the break. We've got the whole event interpreted today for people who are using British Sign Language, and we're really pleased that we've been able to pull together an event that blends both in person and online to reach as many people as we can across the city and county. One of the things I want to sort of say before we start is that this last period that we talk about at any sort of showcase event or an AGM that we'll have later covers a period of retrospection. And I think we can all say we're still continuing to live in a very difficult time as COVID still hasn't left us and is still causing so much anxiety and stress, pain and real issues for those of the people that are continuing to work within our health and care sector. First of all, I want to really say thank you to everybody that's remaining firmly committed to delivering the best services to patients and service users throughout this pandemic. We at Healthwatch Nottingham and Nottinghamshire, as a statutory body, we're here funded by the government, obviously, but we're powered by a very small team and a huge number of dedicated volunteers who have really worked hard throughout the last period to ensure that we're still here to listen, that we're raising and amplifying voices of the people of Nottingham and Nottinghamshire. Our ambition and our aims remain that we want to shape and influence health and social care through the voices of people and communities. We want to enable and empower communities to have a voice and to be listened to. And we continue our commitment to challenging health inequalities and the barriers that communities and individuals face in access, design, engagement and information. You'll hear from me throughout this afternoon's event. We've got some really helpful and wonderful people that are going to talk to you about the work that Healthwatch has done. And so first of all, I'd like to introduce Jane Lawson, who is the Chief Exec of Healthwatch Nottingham, Nottinghamshire, who's going to give you an overview of the work that we've done in the last year. So, Jane.
Thank you, Sarah, and good afternoon, everybody. It's great to see you here. Yes, as Sarah said, I'd like just to give you a brief overview of what we've been doing over the last 12 months. And I've divided it into three types of work. One of them is scrutiny and challenge. One of them is outreach and engagement. And one of them is our project work. So I'll just give you a few examples of some of those. Scrutiny and challenge is a major part of our role at Healthwatch. And when we say scrutiny and challenge, it's scrutiny and challenge of the organisations that plan and deliver health services and care services in our county and city. And what we hold people to account for, what we challenge people to do in these organisations, is to ensure that the voice of the patient, the service user or the citizen is at the centre of planning and delivering health and social care. We challenge these organisations to actively seek and use your feedback, the feedback of the people who live in our area. We challenge them to be transparent and good at communicating with us and with you. And most of all, we challenge them to hear all voices equally. When this doesn't happen, as I say, we challenge it. And you will hear some examples shortly about the scrutiny aspects of our role for example, to support vulnerable patients at the Platform 1 GP practice in Nottingham City and users of maternity services. In terms of outreach and engagement, we seek to reach the people of Nottinghamshire and Nottingham City, which totals over 1 million people. So clearly that's difficult because of the scope is so wide. So what we do is we prioritise, and we prioritise in particular those voices, those people whose voices are not often heard. This year, we set out to increase our reach to specific community groups, especially in Basset Law, people from ethnic minorities, and young people. For example, in Basset Law, we've been listening to groups who support people with dementia, the LGBTQ community, and groups that support some of the most vulnerable people in our county. In terms of ethnic minorities, we've been listening to Eastern European groups across the county, members of the Muslim community in Nottingham City, and Black and Asian communities, in particular around their experiences of maternity services. Going forward, we aim to work to support and empower people to tell their own stories. And we're starting this approach with a project working with young people's groups in the new year. And the last area is our projects. This year we've completed projects on a range of topics which have included digital inclusion, access to dental care and gender realignment. And also we've done 3 projects around the impact of COVID, which you will hear more about shortly in one of the sessions. When we do projects, we make recommendations to the health service, to local authorities, and we follow these up as a matter of course 6 months later, and again another 6 months after that, to ensure that what people have said is actually being used to make positive changes. And you can read any of our reports by looking at our website. They are all there. So finally from me, I just want to echo what Sarah said and put out a big thank you from myself to our volunteers. They are at the heart of what we do and carry out a wide range of roles, and I personally would like to acknowledge and thank them for all that they have done over the last year. Thank you.
Thank you, Jane. So, as a showcase event, I think it's fair to say that we would want to show you the things that we're most proud of. And we've chosen to highlight areas that we've worked in that show the way that we impact. For the impact that we create is for individuals, for services, engagement activities of providers of services, and of course the whole system. So it gives me great pleasure to introduce the first of our guest speakers this afternoon, Glenn Jarvis, who is the Service User and Care Involvement Officer at Nottingham City Council, who's going to talk to you about some work that we've done around a primary care practice called Platform 1 in Nottingham. Glenn.
Thank you, Sarah. Okay. Good afternoon, everybody. As Sarah said, I'm Glenn Jarvis. I've been asked to talk about my experience of working with Healthwatch and how I have seen that they can get involved in an issue and bring about positive outcomes, and was happy to do so. I could actually talk about dozens of examples. I've had the pleasure of working with Healthwatch ever since it started. But today we're concentrating on this one particular issue in this year. I'm Service User Involvement Officer for the City and work with a range of vulnerable citizens experiencing severe and multiple disadvantage. At the beginning of the year, I started to be contacted by service users who had received letters informing them that their GP practice, Platform 1, would be dispersing patients to other practices. This was causing quite a lot of confusion and stress to people. Many had been using Platform 1 for many years, and they liked it there, as they were experts in dealing with vulnerable patients. They didn't like change and were worried that they wouldn't have a practice to go to, or they would be sent to a practice that couldn't deal with their particular needs. I contacted Healthwatch on their behalf to raise concerns about the planned changes and about the difficulties in getting information to this vulnerable and often chaotic group of people. Many of them have no permanent address and struggle to read or comprehend that kind of information that would come in a letter. Healthwatch raised the issue with Health Scrutiny Committee and were asked to write a report, which was then discussed at a scrutiny meeting with the CCG, Clinical Commissioning Group, and key partners in the city in attendance. One of the main outcomes was that the committee asked Healthwatch to set up a steering group of all the organisations working with that cohort, which was chaired by Ajanta Vis Biswas, and I was asked to join that group. The purpose of the group was to advise the CCG on the best ways to reach these patients and to produce appropriate materials. As a result, a worker briefing sheet was produced and distributed, as most of these clients would go to a worker with any letters they received and ask for help. It was important that all the services had the same accurate information available so that they could explain the changes and reassure people about the transition. We advised on the wording, the style of the letters, posters and information cards. Thousands of information cards were produced by the CCG in a range of languages, which we then distributed to all the services that may be working with the affected patients. Thanks to the excellent chairing from Ajanta, the group was dynamic and fast-moving. We had complete cooperation from the CCG and the GP Alliance, who were taking on the bulk of the patient list. As a result, we were able to mobilise a lot of support from organisations and staff, and the transition went very smoothly. This excellent work from Healthwatch was a great example of their effective scrutiny work, ensuring a good resolution to an issue and better outcomes for patients. It also gave rise to a lot of learning points for agencies and helped develop good networking for future work. It was a pleasure to work with Healthwatch on this, as ever, and I am grateful for their hard work and on behalf of those vulnerable citizens. Thank you.
I just wanted to, following on from Glenn's explanation of the Platform 1, to say a special thank you to Dr. Ajanta Vis Biswas, who, as Vice Chair of Healthwatch, undertook that work. And it shows really that at different levels of our organisation, we get involved not only listening to people, but also really supporting how those voices can be heard at a strategic level that really then affects change. So thank you, Glenn, for that. Our next presentation is on video, and it's from Rosa Waddingham, who is the Chief Nurse at Nottingham and Nottinghamshire Integrated Care System and the Clinical Commissioning Group. And she's going to talk to you about the work that we've done together at Nottingham University Hospitals Trust Maternity Services.
Hello, my name's Rosa Waddingham and I'm the Chief Nurse for the Nottingham and Nottinghamshire CCG and Chair of our local Maternity and Neonatal Services Transformation Board. I'm sorry I can't be with you in person, but pleased to be able to talk to you today about the work we've been doing with Healthwatch, especially in relation to maternity. As many of you will be aware, in October 2020, CQC visited maternity services at Nottingham University Hospitals and found there was room for improvement. Since then, Healthwatch Nottingham and Nottinghamshire has carried out actively its role to hold Commissioner and providers to account for providing excellent care by making sure they engage and communicate with local people to feed the improvement plan within the Trust. They've attended monthly NUH Quality Assurance Group meetings and worked with system partners to gain assurances about progress. They have ensured throughout the progress that the voice and experience of citizens are at the forefront of all of our discussions. In addition, Healthwatch have been commissioned to support our local maternity and neonatal systems partnership by recruiting, training and managing our Maternity Voices partnership volunteers, and promoting and seeking the views of people about their needs and experiences in local maternity and social care services. The MVP brings together local women, families and representatives from organisations across our local maternity and neonatal system. They engage the local communities to seek out feedback and share the experiences of women and families with professionals. Through this, they have reported a number of improvements in safety and transformation, most recently supporting the maternity vaccination programme to increase the uptake of COVID-19 vaccinations in pregnant women, ensuring that the voices of women and families were heard and that appropriate provision was made so that people could make their own informed choices about vaccinations. Across the board, they've helped all of us to put the voices of women and their families at the centre of all of our maternity conversations. I am really looking forward to continuing working with Healthwatch and with them improving the quality of maternity services for the citizens of Nottingham and Nottinghamshire, and ensuring that the voices of the people that use those services continue to be heard. Thank you.
Thank you very much to Rosa. And I think the work that we've been doing with maternity services is of really great importance. As some of us will know, there's been lots of issues for families in those services, and it's something that Healthwatch has seen as a really important part of our role to keep holding the trust to account. So we're really proud of that work. Next, I'm going to introduce you to Sarah Furley. Sarah's the Director of Partnerships at Nottinghamshire Healthcare Trust, and Sarah's going to give you an insight into the work that Healthwatch Nottingham and Nottinghamshire does to support governance within trusts. So, over to Sarah.
Thank you. Hello everybody, it's good to be here. So over the next sort of 3 or 4 minutes, I'm going to describe the involvement and engagement process that we do in Notts Healthcare Trust. And describe the governance process that we follow. So just to give you some context, Notts Healthcare Trust delivers both children and adult services to people with mental health needs and to people with physical health needs. And that is both by running hospitals but also by delivering community services. So we offer quite a diverse range of services. So within the Trust, for involvement and for engagement, what we do for involvement is that we invite patients and their families and carers to be part of quality improvement programmes, to be part of co-designing new services, and we ask them their opinion. What we do for engagement is we have patient forums. We invite comments from patients and families through digital methods, whether that's surveys or commenting on Care Opinion, which is a website where people can leave comments. And we also capture the learning, which is really important, from complaints and serious incidents. And so we take the involvement of patients and families and we take their engagement and we look at that and we look at what it tells us. And by service, by directorate and by division, and ultimately to the board of the trust, we feed that information. And as that goes through the organisation, we learn. And not only do we learn, if we don't listen and learn, we then have to act, because there's no point listening if we're not going to act on the advice that people have given us. So that isn't a one-step process, that is a iterative process that happens all year, and then it culminates in a report to the board. What Healthwatch has helped us with this year is to look at that process that I've just described, look at the bits that work, and we're starting to look at the bits that need strengthening, and that work will continue over the next few months and year. So that's what happens within the trust. But of course, as an NHS provider trust, we operate in a much larger NHS and care system. So I'm just going to talk about that wider care system. So at that wider care system, we are working with other NHS providers like Nottingham University Hospitals, like Sherwood Forest Hospitals, but we're also working with the local authority, district and borough councils, and we're working with the voluntary sector. So when we're in that area, what we're doing with Healthwatch is to listen to what they're hearing from communities and populations. And then in that collaborative group of partners, we're acting on that information that Healthwatch is telling us. We're also acting on the information that's coming from individual organisations, such as the process I've just described, and then agreeing what our priorities are in that area. I'm going to give you just a couple of examples to give you a flavour for what actually happens. Obviously, providing mental health services, that is to one of the most vulnerable people in our society. So the kinds of things that we do is that we will invite people who have experienced mental health issues to come and give us their story in a board meeting. And we have even had people that are actually detained under the Mental Health Act, and through digital means they've been able to talk to the board. We've had mental health patients that have actually sat on interview panels and appointed senior leaders in our organisations, which is really positive because we get a patient perspective. And the other thing that we've done is that we've actually asked patients for them to set the agenda and set the priorities. So those are just some of sort of real life examples of what we're doing. And I'll stop there. Thank you.
Thank you, Sarah. You've heard from three speakers how Healthwatch has helped to work with those that are involved in the design, the delivery, and how you plan and pay for services, and that's very much working at a strategic level. And over the next few months, there's a great deal of activity happening around Nottingham and Nottinghamshire, as the NHS particularly restructures to establish what are now going to be called a new integrated care board that is looking at how services are designed, delivered and paid for. So it gives me absolute pleasure today to introduce Cathy Mclean, who is the chair designate of this new integrated care board, who can introduce you to the changes that are happening around the city and county and their ambitions for us here in Nottingham and Nottinghamshire. This is a recording that Cathy made for us earlier.
My name is Cathy Mclean and I'm the Chair Designate of the Integrated Care Board for Nottingham and Nottinghamshire. I know you've got your annual general meeting today and I'm sorry that of course we can't all be together, but I wanted to send you this message which hopefully will give you some insights into where we're thinking at the moment and how we're going to develop over the next few months and your critical role within all of that. So I'm sure you're familiar now with the concept of the integrated care systems and the purpose of those. And I think whatever we're doing and whichever part of the arrangements that we sit in, thinking about our purpose is really important. And we've been given 4 critical things that we've got to do, and those will guide us through this process. So first of all, we need to ensure that everybody in Nottingham and Nottinghamshire has access to high quality care. Secondly, and really importantly, and I know that you're focusing on this today in your meeting, we need to reduce health inequalities. We know there's a range of healthy life expectancies across our population, and that's not acceptable, and we will need to be working to change that. We know that the pandemic has shone a real spotlight on some of the inequalities in health between different groups. So that's a really important aspect of why we're integrating will give us a better chance to change that. The third goal is to ensure that what we do across our system is in a sustainable way from a financial perspective. So everything that we do needs to be effective and efficient so that we live within our means. And the fourth, and actually really important, is our contribution to the sort of social and economic landscape within Nottingham and Nottinghamshire. I know that you are functioning across our whole system, which is really helpful for us, because that means we link with one body. And of course, as you know, Basset Law has recently joined our system, come from South Yorkshire, and I know that you already cover Basset Law, so that's great. In terms of the ambition for our system, I genuinely believe that by working together we can be one of the best, if not the best, system. Of course, I would say that I believe in ambition, but I also think we have the people around us who can make that true. We just need to work out how we align so that that can be possible. I've talked about the way that we need to think about things as a sort of inverted pyramid. And what I mean by this is there are a number of things and structures that, if the bill passes through Parliament, will come into being. So there will be an integrated care partnership, and I'll come back to that later. There'll be an integrated care board, and the integrated care board will become, if you like, the statutory body for the NHS within our system, and will take on the functions currently performed by the clinical commissioning group. But I see both the ICP and the ICB at the pointy end of the triangle, the inverted triangle or pyramid. And the purpose of saying that is that they're there to support the good work that will happen through the provider collaboratives, where the big organisations come together at scale, but also other collaborative arrangements. The places, so we've got 4 places, place-based partnerships, Basset Law, Mid Nottinghamshire, City and South Nottinghamshire. And those places are going to be where a lot of the work is done. And then I see neighbourhoods. So these are smaller communities, often sort of described as about 50,000, though some of ours will be bigger, and with, you know, primary care at the heart of those alongside the communities. And then really importantly, if you can still imagine this inverted pyramid, it's got wider as it's gone upwards. And then we have, really importantly, the population at the very top of this inverted pyramid, the widest bit. And this is a really important area for you. Obviously, we'll be bringing forward the views from the population. So I want to avoid us ending up with a hierarchical situation where everybody thinks that the Integrated Care Board, where it's all happening. I want to think that, yes, there's some governance around the way we use the money. There's some governance around holding ourselves to account. But actually, we are enabling the people at the front line, the people working out in the communities, the population and people who live in Nottingham and Nottinghamshire themselves, to actually make these improvements. Because, as you know, people at the front line, the people who are living the experience, usually know what the solutions are. What they need is support and enablement. We're setting up, of course, a number of structures and so on. As I've intimated, the Integrated Care Board is going to be the statutory body. That's the board that I will chair. I'm currently chair designate. You may be aware we now have a chief executive designate in the form of Amanda Sullivan, and we are in the process of appointing non-executives, and then we will appoint executives to that. We've had to have our structure signed off by NHS England, and I'm pleased to say that our initial board has been signed off, and we will shortly be submitting our constitution. All of this sounds rather dry, but what's really important for me is that we have many places in which the voice that you, for example, and others will bring around patients, the citizens and so on are really loud and clear. And we have been discussing, and indeed at the current Integrated Care System Board in November, we had a big discussion about how we get the citizen voice into everything that we do. And I know that your strategy, you know, for the next few years is in place, and I know that you're very focused on inequalities, and as I say already, absolutely so are we. And I think bringing that voice to the fore, and I know that, you know, gathering people's experience is one thing, but also I want to go further than that. We need to turn things round, so rather than us telling people how it might be, asking them what they think, actually getting people to design the future alongside professionals and clinicians and others. So that's going to be really important, and your role in all of that is going to be absolutely vital to the way this system works. In order to function, as I say, we've got various things to set up between now and the end of March. But there's an awful lot of other things to do as well. And I talk quite a lot, as well as my inverted pyramid. The other key thing that I keep saying at the moment is that there are 3 things we need to do between now and the end of March. One is deliver all the operational you know, requirements that the citizens and patients need. So that includes managing the emergency pressures across the system through winter, and it feels as though that has arrived very early this year, and that's going to require everybody from voluntary sector, primary care, hospitals and social care to work in tandem and absolutely together. So emergency care, the recovery of the backlog, we know that people are waiting a long time, and that's part of that really important work that needs to go on over the next 3 to 4 months. Vaccinating the rest of the population, reboostering people who've already had 2 vaccinations and so on. So basically, number 1 that I'm talking about is delivering today. The second, and really important if we're going to be a successful integrated system, is keeping an absolute focus on some of the transformational things that we want to do. So the things that will start to impact on equality. And we're still managing to keep going with some of that at place, and also across the system we've got 3 sort of signature areas that we talk about around personalised care and community and so on. So those are carrying on. As I say, at place, they're still carrying on with the work that they're doing, but also getting themselves into shape. So that's thing number 2, is transformational things. And then the third, which I've already alluded to, is we do have to get ourselves into good shape for the 1st of April, assuming that the bill goes through Parliament, and it is making its way at the moment. It will need to get royal assent and so on. And then, as I say, CCG will cease to exist, and that will move into the Integrated Care Board, but there will be other things to do around that. So we will have we'll have a board initially of 14 people, 10 of whom are prescribed nationally, but we've added 4. And that allows us to work over the next year or so. Starting in April, it's not the end of the journey, it's only the beginning of the journey. And if we do need to change or add things, I think we've got some space to do that. So I didn't want to have a huge board which would give us no future potential for change. So that's going to be quite important. We're currently talking with each of the places, so that's the 4 place-based partnerships I mentioned, and we're discussing with them what we can do best to ensure that they're in a good position to move forward and support local innovation, changes, and so on. One of the things that's going to be really important if we're going to change our approach to health inequalities and make an impact is to measure outcomes. I think we're often very good at measuring the things that we've put in rather than actually what impact have we had. So we do have an outcomes framework for Nottingham and Nottinghamshire, but I want to make sure we have a golden thread which links that to everything that people are doing right at the front line. So we've a lot to do. Your role is going to be absolutely critical. I'm really pleased that we've got a really well-functioning Healthwatch, and that mercifully you are joined up across Nottingham City, Nottinghamshire and Bassetlaw, who have just joined us, as I said. That's a really great start, and I know you're really, really clear in your strategy, and I think we should work closely together. You'll have a good chances through some of our work and advisory group and that sort of thing, and this will develop over time. You will have the opportunity to do all your different roles, including scrutiny, but also acting on behalf of patients and indeed citizens across Nottingham and Nottinghamshire. So I hope I've given you a flavour of where we are. I'm very keen that we have an open and transparent approach to things. We will be conducting our key meetings in public, and that's going to be, it's always an important part of being held to account by our local population. And this is going to, I think, drive forward more change in the future. Our work with local authorities is going to be key, and we have good foundations for that. We've got good relationships with colleagues at the city council and also at the county. And I think that by working together alongside other groups, City Care, the voluntary sector and a much wider collection of people, I am absolutely convinced we can do our very best for the citizens of Nottingham and Nottinghamshire. I hope you have a great AGM, and I look forward to working closely with you over the next few years. Bye-bye.
Thank you to Cathy. I think the ambition and the amount of work that has to be done in a very short period of time by our colleagues in the NHS is a huge mountain to climb. I'm grateful that we've been able to have Cathy explain a little bit about the new Integrated Care Board, as it does have to be in place legally by the 1st of April. You've heard from Cathy just how much importance they're putting on the citizen voice, the patient and carer voice in how they're developing their plans. And Healthwatch, our role is very much to hold them to account for that, to ensure that they are involving people. We're already involved in arranging some events that will support people to have their say and to learn more about the Integrated Care Board. There's a lot of synergy, if we look at it, between what we're trying to achieve, which is to elevate people's voices to affect change, and the words that are being said around the new Integrated Care Board are very much the same. It's important that Healthwatch continues to raise and elevate the voices of people that are very rarely heard. As we heard from Glenn, when people are not listened to, their voices aren't heard, then services can be designed in such a way that totally excludes them. And it's our role to make sure that those voices are absolutely front and centre when things are being redesigned and redeveloped. So we're really pleased that that commitment has been stated today by Cathy, that the Integrated Care Board is very committed to listening to people. And we at Healthwatch will absolutely be holding them to account on that and acting as a critical friend where we can be, and working with communities around Nottingham and Nottinghamshire to elevate and amplify their voices and bringing them to the table where we can. Cathy mentioned the challenges that are ahead for them as a system, but those challenges affect us as people of Nottingham and Nottinghamshire. So those issues that are going to come fast and furious as we start to enter into the winter period, with emergency care, recovery from the backlog of treatment that was held off by the worst of the pandemic, and making sure as many people as possible are vaccinated in our city and county, as well as receiving their booster. We've still got a long way to go with some of our communities who still fear vaccination, and we hope that we can really support where we can to get the messages out there that that is one of the ways in which we can all be together more often in venues like this today. So we're very encouraged that Cathy and the Integrated Care Board are very keen to work with us at Healthwatch. We're also very pleased, if I'm honest, that Bassett Law has been now brought into the Nottingham and Nottinghamshire Integrated Care system. For a small Healthwatch like ours, we not only covered the shadow form of this new way of thinking here in Nottingham and Nottinghamshire, but we also had to work with Yorkshire and Humber in order to work with our Bassett Law colleagues. And I think you can imagine that for a very small team and the volunteers that we've got, that's a huge ask. So we're pleased that we're bringing them into a unified system, which I think will make our lives easier, if nobody else's. So very encouraged that they want to work with us, and we will continue to hold the Integrated Care Board to account, support where we can, and ultimately bring people's voices to their attention, and also empower people to actually use their voice in ways which will make the NHS listen and create services that are relevant to them, and bring together communities that have been facing some of the worst health inequalities that we've had in our lifetimes. The pandemic really did show to everybody that there are people in our communities who get a much worse deal than others. And we've all been working very hard to try and not only help people understand those differences, but understand what we can do about them so that we can reduce those health inequalities, which I think is an endeavour that we can all sign up to. I'd now like to hand back over to Jane. We've heard a lot about strategic things that the people that make decisions, the people that pay for the services, how they're designed. I'd like to now turn our attention to the voices of people that we've worked with and the different ways in which we've engaged with people on some very important issues. So I'm going to hand back over to Jane, who's going to take us through some of the work that we've done in the last year, particularly around those impacted by COVID.
Thank you. Yes, I would like to just talk to you about 3 pieces of work that we've done around COVID and the impact of COVID on the services people have received and how that's impacted on them. So over the last year, we've developed and delivered 3 projects. The first of those was on maternity services. So we work as Healthwatch with the Maternity Voices partnership, which is essentially a team of professionals and parents who work together to improve maternity care. And our responsibility is to lead the work to talk to parents and find out their views, working with volunteers to do that. So with the Maternity Voices partnership, we wanted to focus on care during and after pregnancy, which changed due to the COVID restrictions that were brought in, many of which were nationally mandated. And we asked local families how they experienced these changes. For example, partners and family were not always allowed to join their loved ones to appointments. So what we did was we worked with 10 mothers to design and distribute a survey, which led to a staggering 354 responses, which is the highest return we've had in 3 years of supporting the Maternity Voices partnership, and indicates quite how important this issue was to those people. Our findings through this work have added significant evidence to the importance of having partners present at scans, to having partners present at appointments, at induction, at labour, and after birth. Healthwatch and Maternity Voices Partnership would like to thank all the women and partners who contributed their insights by sharing some very traumatic experiences of anxiety, loneliness and helplessness. And we hope that the findings from this piece of work will avoid further restrictions on parents' rights should we go back into a lockdown, and that the trusts and the whole national system can learn from the impact that that had on these people. The report that we've done on this piece of work is in the process of being published, and once it's published, will be on our website. The second piece of work I want to talk about is work that we did with people who had lived experience of long COVID. And we worked with these 3 people to co-design and share a survey with other people who were suffering from long COVID to find out the main health and care issues affecting COVID survivors. And these 3 people have kindly given their time to make a video to share with you. So I would now like to play a video with Chris, Lynn and Val sharing the work that they did. Thank you.
So my name's Chris Redfern. I used to be a teacher and then a psychotherapist. I'm now retired. I got involved in the project because I saw that there was a survey going to be done for people who had COVID and were still having symptoms. So I put my name forward for that.
Hi, I'm Val Brownlee. I'm a retired nurse, mostly with clinical quality and patient safety, with a history of involvement in research. Obviously, as a long COVID patient, I was interested in as helping to find out something new about it, because it is all very new. There's very little research, so it's a great opportunity to delve into it and find out a little bit for myself as well, I've got to admit.
Yeah, I'm Lynn Woodhouse. I was 57 years old, caught COVID, was ventilated in a coma for over 5 weeks last year in March. Came home in the May and still struggling on. I was approached by, initially, the charity trust for the hospitals to help bring awareness of long COVID suffering, and to help raise money for charity for that. And through that, I was contacted by Healthwatch to ask to help with it was the discussion and designing of a survey for long COVID sufferers.
Having seen that there was this survey going to take place, I was particularly interested because I found that, I I've got long COVID as well as having COVID, and there didn't seem to be very, very much out there regarding information or support groups either. So I was very interested, I think from a personal point of view, to try to find other people who'd had COVID and how they'd found the experience and how they were coping. So yes, we took part in the focus group, which was, quite a few people involved. And then as we progressed through that, Healthwatch asked us if we wanted to be involved in doing more work on the survey. So actually looking at the questions, looking at the feedback, once the questionnaire had gone out, and we were actually involved in that. So Lynn, Val and myself actually worked alongside Alison and Hess, which, I'm sure I speak on behalf of all of us, that we found it really, really valuable. And the thing that really impressed me was how inclusive they were about listening to us, hearing our voice, our experience, but also then including us in all the feedback and writing the report. And that was really, really valuable.
Yeah, we were involved in quite a lot of the steps, as you mentioned, and where we lacked any knowledge in doing that, Healthwatch were very good in providing some instruction. They provide some learning for us to help us through those, so that we could be involved in each section. And of course, it's always been slightly difficult with us because of our health reasons. We're not terribly reliable, but you know, we did manage it.
I think it was a good group dynamic to get involved, for us all three to get involved, because we've all got different perspectives of the patients out there. So, you know, we had a broad overview of, we could try and help everybody and try and ensure that all areas were covered to get the best possible results from the survey.
I mean, I think also that when we did that survey, there really wasn't a lot known about COVID at all. And so, you know, everybody was in the dark, really. And in terms of symptoms, because that was part of the survey, wasn't it? Finding out how we've been affected, both physically, you know, and also emotionally. And now there's definitely more information out there. I think now is much more detail. They know more about the symptoms. I still think there's a massive gap in terms of helping people, you know, treating people for some of their long COVID symptoms.
There is a sense of that. I think that I probably speak for Chris as well. That we're all gained in terms of being involved and being able to help other people. And I think that's why we're all anxious to see that things are implemented. People can have a, you know, much quicker diagnosis and get on with the treatment. I do still think it's still early days, and access to long COVID treatments and diagnosis is still very slow at the moment. We understand that, you know, health organisations are put in progress pathways and started to implement initiatives, but these really aren't reaching patients just yet. I really enjoyed being part of it, and I think I was able to tap into some previous skills and to have involvement in designing the questionnaire and the analysis and then dissemination of findings. I thought was brilliant, because it wasn't just a case of asking us to what our opinions were and then saying thank you very much and moving on. Hez and Alison in particular kept us involved and informed, which was really great.
I agree with that as well. It gave you a sense of purpose as well, that you were helping others through all this, and be able to see it from start to finish and see the report itself at the end is it's an achievement. You feel you've achieved something and you're helping people and it's going to help others.
It's rewarding, isn't it?
Yeah, very.
Yeah, so, and I think I would say to I know Healthwatch covers a whole range of projects, and certainly in terms of those projects, you know, I think we'd all suggest that if there are people who that particular focus applies to, you know, whether it's pregnant women or whether it's people are in the deaf community or people with diabetes or whatever, it's really, really useful and so much more relevant if you can get people involved in future projects who have actually had the lived experience.
So I hope that if Chris, Lynn and Val are watching, I'd just like to say a very, very big thank you to you from us at Healthwatch and to all those people who are suffering from long COVID for the work that you've been doing. And this is a good example of the way we would like to work more going forward, that we empower people to tell their own stories, to be involved more in the work that we do, because the powerful voices are for the people who have experienced the services or not experienced the services. That is where the power to change and the power of persuasion comes. And I'm also delighted that they've also been along to a COVID pathway redesign group, so they have taken forward their findings into some of the meetings to plan and design services going forward. So we're really grateful for them for all the time they've given. Our last project is around the experiences of relatives of residents of care homes, which we did around Christmas time last year. We received a number of experiences from some distressed relatives who were unable to visit their relative. As you will recall, there were a lot of restrictions at that time. And they were distressed that they weren't being informed how their loved ones were. It was particularly upsetting for families who usually come together over Christmas, or for whom regular visits are an important part of their daily life. We talked to Nottinghamshire County Council about this and found that they'd received many similar insights and were keen to find out how they could better support relatives. So they came together with our Enter and View team, which is some of the Healthwatch volunteers who have specific skills in carrying out investigations in care homes, to develop a project together. And over the following month, these interviews interviewed 37 people to find out how improvements could be made. And I'm delighted to now invite Gemma Shelton from Nottinghamshire County Council, who was our key contact, to explain what impact this work has had. Gemma, thank you.
Thank you, Jane, and thank you everybody for welcoming me this afternoon. Hopefully, yes, it's worked. So obviously Jane introduced the project really well. So what I'll do, and hopefully it's helpful for you all to understand a bit of the background as to, I know Jane's sort of mentioned it, but obviously the pandemic hit us all March last year, but actually hit our care homes in Nottinghamshire really, really hard. Actually, and a lot of the COVID hit, and there was a lot of unknown, and our care homes were expected to deal with this and work with this. So actually, it was a really difficult time. COVID hit, and in Nottinghamshire, we've got nearly 300 care homes. So it's not a small cohort of services that actually needed a bit of help. There was such a lot of services. Some worked very differently to others. So it's a very, very frightening time. COVID hit. And then on top of COVID hitting, there were outbreaks, the services were impacted, the people living in the services were impacted, and also the relatives were not allowed to go and see because obviously lockdown hit. So there was a lot of factors and some severe worrying times for both people living in the services, the workforce, working in the services, and also friends and relatives and the loved ones of those living in care homes. And included in this background, which I think is helpful for you to understand, is not only was COVID hit, they had all different guidance that was being thrown at care homes to support them, but there was such a lot happening at the same time. So it was such a busy time for our care homes. And actually, they were looking at everybody for support to try and get them through this such busy time. The workforce I've talked about, they were impacted. They were also impacted themselves personally by COVID. Also, it was a frightening time for them working in COVID, PPE, etc. As we're all wearing masks still, but obviously they've got to continue wearing masks all day when they're working in care homes. And also colleagues have previously mentioned the vaccination programme. So all in all, I think this from March last year, our care homes have been through the mill massively. And actually what happened, as Jane explained, relatives and friends were also at the side of that, and actually they felt they weren't being taken into consideration through this whole lockdown period and through this frightening time. So, impacts, obviously, I've talked about the lockdown. Obviously, friends and relatives couldn't go to see their loved ones. They were restricted. As we were all restricted in our own lives, we really couldn't leave our own houses unless we had to for a period of time. Didn't move on. I talked about outbreaks. Outbreaks were so severe at certain points from March onwards last year. We had at certain times about 100 care homes experiencing outbreaks. And some of those outbreaks were nearly everybody in the care home was impacted, including staff. So massively worrying times in terms of managing to keep people safe, but actually at a time where people were really poorly and also the staff were poorly as well. Testing, that was obviously came in probably summertime of last year. So obviously a testing regime for not only the people living in care homes, the staff. So it was another thing that our care homes had to manage as well as everything else. So it was a massive impact. I can't tell you how our care homes have managed and how they've got through this last 18 months. Technology in care homes, very different throughout. We've got 300 care homes, some with lots of technology, some with none at all, some with no Wi-Fi or no access to Wi-Fi because they're big old buildings, so Wi-Fi doesn't work. So it was a massively scary time for them all, and also at the back of all this, there wasn't any additional funding till the end of last year from the government, where grants started to come in to support. So obviously that limited even homes that wanted to make additional contact with relatives. They were restricted because of technology and workforce, etc. And I've put at the bottom of my presentation, hopefully everybody can see that, actually a lot of people were so scared they didn't actually know what to do next. And Healthwatch really did help at the time, where my team, who have responsibility for quality and contract compliance for care homes, were trying their best to keep services safe. Where actually we didn't have the capacity to get the voices of those relatives who were already contacting us saying, we can't get in touch with our loved one, we've not heard anything. All these examples, and we wanted to do our best to get their voices to hopefully help providers and care homes to improve their information to relatives during lockdown specifically. So moving on, Healthwatch asked a series of questions, as Jane said, in terms of the volunteers supported. So asking what information, so relatives were asked what information they were getting, how they were being contacted, what that contact looked like, whether the information was sufficient. So there was a range of questions that actually we agreed between ourselves what to ask those relatives to give us a good view of what it was like out there, what the landscape was like in terms of that information, and important information about their loved one in care homes, about their health, welfare. And actually in care homes, there's a lot of people with dementia who really struggle. And actually, even if the technology was perfect in care homes, it's limited. And relatives really wanted to see their loved ones. So actually, it was really helpful in terms of getting that viewpoint of the relatives. So, findings. I don't think any of it would have been a surprise to any of us. Some care homes doing lots of other, and some doing no communication at all. So we had some really fantastic examples of some care homes really trying hard, whether it be through social media, use of iPads, again limited, but actually it was better than nothing. And then there were other care homes, and through no fault of their own, they were just restricted because they didn't have enough staff to do it. There was all different reasons, but we did find there was such a different experience throughout the county. I've said about residents with dementia unable to use technology, care homes all approaching communication differently. So what we did throughout the pandemic, the start of it, and obviously until we started this project, my team, who were working 7 days a week throughout the pandemic, were trying their best to support care homes to improve communication. But actually what we weren't getting was the voices, and I think basically we were just in emergency mode, so actually we wanted to bring it together, and Healthwatch supported us with that. Again, I mentioned families not seeing loved ones for a long time, and we were talking months. It wasn't just days or weeks, it was a long time, as we experienced. Lockdown was a long time, but care homes were impacted probably before our lockdown and after. And obviously if care homes were experiencing outbreaks, that's another further period of closure. And then some care homes had continual lockdowns. So it was such a worrying time, as we all know. So out of the project, we had a number of recommendations. I won't repeat them word for word, but care homes being responsible to being proactive, contacting the relatives and friends of people living in care homes, because actually it's important that they do that, because actually their loved ones are in the home, they want to know what's happening with their loved ones. So actually, so that's one of the recommendations. Care homes should consider a range of ways of communicating with friends. I've talked about social media, but actually making time to contact relatives either by phone, Facebook, WhatsApp group, or use of all the social media we're all probably using or not. And actually a weekly email, actually just to see something regular on it, actually made such a difference to those people that were getting it. So actually it was a real positive outcome by using those kind of forums to get in touch with relatives. Increasing any frequency of contact. We had examples where some were doing it monthly, some were doing it weekly, so there was no consistent approach. So obviously that was one of the recommendations. And care home staff should ensure the staff are trained to use electronic communication systems. we do see, and we still do see, a variety of skills out there in terms of use of technology. That's something that's going to take us time, and we are working with NHS and NHSX in terms of offering some support to care homes. Care homes have been given free iPads to help towards that improving technology. So there has been help and support, probably later on during the pandemic, but actually we are trying our best to actually improve skills of the staff working in care homes. But again, they're all very busy, so it is very difficult, but they're all trying their best. And council and care homes should consider developing a communication charter to manage friends and relatives. We were trying to improve our contracts in terms of making it sure that care homes are actually do communicate well. But actually the communications charter is something we're working towards. And again, I know it was Christmas last year, but things have taken over in terms of the pandemic's continued. We've seen further waves. So that's a plan that we're going to take forward and working with our providers, care home providers, to actually put this charter together for the next year. I've talked about support for care homes because we keep doing 2 care homes and we're asking care homes to do a lot. Some of it they need to do, but actually it's very difficult them. So there's been some grant funding I've talked about that's come down from the government, and that's infection. The IPC, apologies if you're using acronyms, is Infection and Prevention and Control. So that's around financial support around PPE costs, obviously having more staff on duty, obviously rooms. It's just been very difficult, and it's obviously at a cost to a lot of our care homes. We do regular contact. We've continued that. We're not probably doing 7 days a week now because things have slightly improved, but obviously we're aware of the months we've got coming up in terms of winter. Updating guidance changes throughout the pandemic. I can't say how many times the guidance changed in response to COVID. So we do try our best to make sure that care homes, not just care homes, home care, etc., are aware of what changes have been and what that means for them. And we continue to do that. And sharing good practice. So my last slide will show that from the recommendations from the Healthwatch report, we did a fancy slide that was shared with all our providers to try and make it a bit easier for them to understand what good communication looks like, and we continue to do that. And any good practice from care homes in terms of visiting. So one of our care homes in Nottinghamshire changed one of the rooms that's normally a bedroom, changed its use into a visitor's room, so it's specific for visiting, and that met all the infection control. So actually we shared all that kind of good practice so other care homes can understand they're not on their own, things are possible, and actually it did help. And also I've talked about the free iPads and other tech. And there's, the last slide's not showing. There is another slide, and unfortunately you won't be able to see that, so apologies, I don't know why. There is yeah, it's there. So basically the recommendations I mentioned in my report went on to this night, and we shared, obviously it was Christmas time as Jane explained, and we shared this festive tips along with other things around visiting. It wasn't the only thing we did, but I thought this was quite a nice thing to come, and actually we are coming up to Christmas again, and hopefully not a lockdown, but obviously this is something we will be sharing again if it does come to that, but also good communication is key anyway, so it's not something that actually is just around COVID. So thank you very much. Thank you.
Thank you, Gemma. That was a very insightful presentation, and yes, kept us all up to speed with what's going on in care homes as well, so that's very helpful. So just to sum up this final section, the work we've done in these 3 areas, as you can see, has brought significant evidence to our decision makers about the effect of long COVID and COVID restrictions on specific groups of people. We have shared all these findings locally, and we'll also be sharing them nationally as part of the COVID inquiries as they go forward. We will make sure that the insights and the experiences of people in our county and our city is also part of a more national view of things. And thank you very much. That's the end of this section.
Thank you, everybody, for those really interesting presentations this afternoon. I want to pay particular thanks to Chris, Lynn and Val, who were involved in the Long COVID project, and for making that fantastic video. Also I'd like to thank Melanie Brooks, who's the Director of Adult Social Care at Nottinghamshire County Council, who, when we contacted them to talk about the experience we were gathering in care homes, absolutely threw her weight behind everything that we wanted to do, and especially to our interim view volunteers who took the time to go into care homes to talk to relatives. That just highlights another type of volunteering that we've got here at Healthwatch Nottingham and Nottinghamshire. Our interim view volunteers are given really good training and are able to, when we can go into care homes, meet with people and really build those experiences. Finally, I'd like to thank Gemma for her contribution and those festive top tips, which I think are going to be really helpful. We're going to take a short comfort break now. We're going to continue broadcasting, but so go and get yourself a cup of tea if you're at home. Interesting biscuits I'm sure you've got there. We've got some fantastic ones at the back for those that are in the room with us. And we're going to come back in 10 minutes at 2:50 when we'll take questions that you've been putting in the chat and in our Ask It basket here in the room with us. So we'll see you back at 10 to 3. Thanks. Right then, welcome back everybody. I hope you've had a time to make a nice drink and take a break. I know you had a lot of time listening to people. During the break, we took questions from our chat, and we also took questions in the room in our very wonderful Ask It basket, which I think is a great way of asking people to give questions. We've had a number of questions that have been posed to us, and I've got people who have got different areas of expertise throughout Healthwatch to answer those. I'm going to go with the first question, which was from the floor here, which was, what plans are there for Healthwatch to build on the initial long COVID engagement project that we did? For example, access to relevant services and treatment of symptoms over time. That was from somebody from our City Care colleagues. So I'm going to ask Alison to answer that question.
Hi, I'm Alison Bourne. I'm an Outreach and Engagement Officer for Healthwatch Nottingham and Nottinghamshire. I worked with the volunteer researchers on the long COVID project to find out what their health needs were and how to improve services. We're not currently working on any new projects with long COVID, but we do welcome and are very keen to work with trusts and organisations to improve the design and delivery of long COVID services. So do come forward if you would like to do that.
Thank you, Alison. I think it's really important that people living with long COVID at the moment are given choice and have different places in which they can receive services. It's obviously a new condition. People are very unsure what the symptoms are and how they can get help. So it's something I think that we will be working very closely with people who've got a lived experience as we go forward. I'm going to take a point that's been raised now rather than a question as such, but I think it's a really important point that's been raised around the issues affecting disabled people within the system, especially when we're looking at health inequalities, and we talk about health inequalities in this big, broad term, but actually it relates to all sorts of different people. We've heard about the work that's done with the Black, Asian, minority ethnic communities, and also looking to see, well, who else is in that? We've talked about lesbian, gay, bisexual, trans, queer inclusion, but disabled people make up a very significant part of our population. And I think it's important that when we talk about the period we're in the pandemic, there have been the hidden people, I think, within the pandemic, often not able to come out into society because of the risk that they face because of the virus, and have been very much hidden in the conversations, as I think those of us that have an identity around disability will also understand is something that happens in a lot of different places and a lot of different services. And the point, I think, has been really well made that we do need to ensure that disabled people are not ignored when we're looking at the systems that are being developed, the new integrated care system, and that when we talk about health inequalities, we really name the people that we're talking about, the people that are affected the worst by the wider determinants of health, poor housing, people who are living in very difficult housing conditions as a result of maybe acquired disability that means their houses don't receive the adaptations that they need, the wider determinants of health in terms of employment, the number of disabled people who don't access employment, employers still not taking on the fact that to employ disabled people can be an absolute bonus to their workforce because people come with an amazing set of skills, knowledge and experience. And I think the point here is for us is Healthwatch. What are we doing? How do we prioritise our work? And I think, you know, as chair, I want to reassure you that when we're looking at health inequalities, we are looking at what we can do. I mentioned earlier before the break, we're a very small organisation with the biggest remit of any organisation I know of in the city and county. Individual provider trusts, the NHS, social care only have a particular area that they're responsible for. Healthwatch is responsible for all of it. So we have to prioritise, and sometimes it seems that we're prioritising one thing over another. I want to ensure you that when we're making some of those decisions, it's a resource capacity issue. We'd love to be able to encourage more people from the disabled community to volunteer with us so that we've got more access to people who've got a real reach into that community and hugely understand the issues and the impact of wider health determinants on their selves and their families. So going forward next year, we've started to do some work with the DIG group, the Disabled Action Group here in Nottingham. We've started to build a relationship with them to create a Healthwatch Hub, which is really important in terms of being able to reach into to individuals within the disabled community and how we can then raise and elevate those voices to support disabled people themselves to have the voice to talk to the integrated care system particularly and the other structures that are around that. That's what we're dedicating ourselves to for the next year in terms of raising the profile of people affected by health inequalities. Of disabled people are definitely part of that group. So thank you for raising that point, Dora. I'm going to move to a question now that came from our online, which is around Basset Law and what work have we been doing in Basset Law. I think this is important as they're now absolutely have always been part of Nottinghamshire. I just want to point that out. And Healthwatch has absolutely always been invested in working with Basset Law. And now that that area has been included into the integrated care system for Nottingham and Nottinghamshire, it's going to be even more important that we continue to raise the voices in this very new arena for some of the work. Not all, because the County Council is absolutely involved in Basset Law, but from a health perspective, there's going to be a lot of new systems for people to navigate from that area. So I'm going to ask Alan Rhodes to come and speak to that question. Thank you, Alan.
Thank you very much, Sarah, and I'm glad that Basset Law has been mentioned, actually, because I'm a Basset Law person and that community is very important to me. So we have spent a great deal of time listening to the experiences of seldom heard groups within the community in Basset Law and talking to organisations and working in partnership with organisations that are working with those disadvantaged groups. And we've been speaking on many occasions with those organisations about the issues that are affecting Basset Law people where health and social care is concerned. We've been talking to groups such as the Dukery's Memory Group, the Oasis Centre, Focus on Young People in Basset Law, Centre Point, which is an organisation that supports the LGBT community. We've been talking to groups that support the Eastern European community in Basset Law, and of course not forgetting the rural communities in the east of the district, Redfern and beyond. All are facing some very similar problems in respect of accessing health and social care which is suitable to their needs. We attend the Basset Law Partnership meetings, which include local authority, health and voluntary sector organisations, the Integrated Care Partnership, the Health Inequalities Group. And the views of Bassetlaw residents have been included in the Long COVID Survivors Project, our Digital Inclusion Question of the Month, and our Dental Care Hot Topic. So Bassetlaw is very much at the forefront of community development and engagement in Healthwatch, Nottingham and Nottinghamshire. And I'm very pleased with the work that we're doing there, and we aim to do much more in order that we can hear those voices and make a difference to people in that part of the county. Thank you.
I think unfortunately we've sort of run out of time for questions, but what we will be doing is taking all the questions that were put on to our chat and in our Ask It basket. They'll all be answered fully and they'll be available on our website afterwards as a Q&A to the showcase session, because obviously we want to make sure that we can answer everything that's been put to us today. I'd like to thank the panel, that not everybody got asked a question, which is great, but very much thank you to Alan and to Alison for answering those questions. We've got some a video now that I think is going to be really interesting for those of you who wonder how we do what we do, who are the people that do the work for us. So I'm very excited to show you this new video that's been developed for us, talking about volunteering at Healthwatch Nottingham and Nottinghamshire.
to all of our volunteers, whether you've been able to carry out your role in these strange times or not, whether you do a little or whether you do a lot. It's all part of helping to achieve what we do. Without you, we couldn't be a Healthwatch. Thank you.
I really like that video, and the number of times around Grand's Hatch I think is a real example of just how much time people have given us over this last year. And it's with that I want to draw a close to this afternoon's proceedings by saying that if you've heard something that's really interested you or you've become intrigued by how we do things, I'd really like to welcome you to think about becoming a volunteer for us. We're actively looking for new board members at the moment. Our AGM is going to follow this, and we really do want to recruit new board members, particularly from the communities that we serve and who have got a range of skills. And also, if you're interested in working with us at a very strategic level in some of the work that you've heard about today, but you're not got the time commitment to become a board member, this role that we have as a strategic volunteer might be just for you. We have an incredible team of people that sit on many different boards for us, different forums, do some of the governance support work that you've heard about, that are working at patient involvement level, and we give training and support to everybody that works for us at Healthwatch. So if that's something you're interested in, please have a look at our website. We've got an open day on the 13th of December, 2 sessions on Zoom, one in the afternoon and one in the evening. So if you want to have a look at our website, all the details are up, and you can apply for an application pack if you're interested. But do come along to the information day and find out more. So it now leads me to say my big thank yous today. First of all, I'd like to say thank you to Nottingham Audio Visual Services who've broadcast for us today. I feel like I'm in a television studio. You can't actually see how we're set up here if you're online, but very much thank you to them for all their technical support for this very blended event that we've achieved this afternoon. I'd like to also thank Nottinghamshire Deaf Society for welcoming us into their venue here in Nottingham, to the team at Healthwatch and Nottingham and Nottinghamshire, particularly Nathan and Deb, who've put so much effort into the organising of today, and to everybody from the team who's put so much effort into not only this showcase event, but to the work that the showcase has demonstrated. You've done an amazing job over the last year. I'd like to say thank you to our speakers, Cathy Mclean from obviously the ICS, Glenn Jarvis, who's still with us, Rosa, who was on film, Sarah, who unfortunately had to leave early, but she was really happy to be here, to Chris, Lynn and Val, our long COVID survivors who got involved in the project. I want to say a massive thank you, and last but not least to Gemma, Shelton, who finished off talking to us about the issues in care homes. Last but not least, I want to give and say again a big thank you to everybody that volunteers their time for Healthwatch. It's something that we can't do our job without. The amount of funding that Healthwatchers are given nationally is a tiny amount of money compared to the job I think that we have to achieve. And we can only do that by asking people to give us their time, their knowledge, their experience, to support us to deliver what I think is a vital service in which we can elevate and amplify the voices of those that are very rarely heard, along with the ones that often get sat at the table. So I want to say a massive thank you to them, and also to the people of Nottingham and Nottinghamshire who've shared their experiences with us. Experiences often feel like a bit of a giveaway, particularly when organisations want to do consultation. They ask lots of questions and they demand a lot of people, and very rarely do they get given anything back. So one of the things that I want to say is a massive thank you to everybody that shared with us at Healthwatch Nottingham and Nottinghamshire over the last year. We take your experiences, we hold them, we know how valuable they are, we know what they mean to you, and we are determined to make the best use of those experiences to make something different for the next person. So thank you everybody for attending. It's been a fantastic afternoon. It's been a new experience for us doing something in this way. I hope you've enjoyed it at home and online. This is the end of the showcase. We will be having our formal annual general meeting, which starts at 3:30. You're very welcome to stay for that. We'll continue to broadcast, so if you want to stay with us, we'll be meeting again at 3:30. But for now, thank you so much for attending, and we look forward to seeing you next year. Thank you very much. So, welcome everybody to this next part of our afternoon's proceedings, which is the annual general meeting of Healthwatch Nottingham and Nottinghamshire. Welcome to people that have stayed with us online as we're broadcasting live, and for the people that have stayed with us at the Nottinghamshire Deaf Society this afternoon to be part of our annual general meeting. So, first of all, I want to see if we've got any apologies, and the apologies this afternoon are Matthew and Ajanta. So my colleagues behind me are the rest of the board, and we'll be sort of referring to them throughout. And then we have Ian, who is our treasurer, who's joining us remotely for this afternoon's event. So that's Ian Blair, who's our treasurer on the afternoon. So those of you got the minutes of the last meeting. First of all, I'm going to take those for accuracy. Anything that we need to look at? Yep, fine. And so can we accept the minutes of the last meeting as a true record? I'll propose that. Could I have a seconder? All of you. Phil. So everybody happy to accept the meetings? Yeah. Brilliant. Thank you very much. Sorry about this. This is the way we're having to do it for the broadcast, so I'll be turning around so everybody can see us. Next on the agenda is a review of the previous year's activities. The showcase event that we've held previously, which the recording of which will be on our website if you've missed that and you've just joined us for the AGM, which I do encourage you to watch because there was a lot of information about the type of work that Healthwatch does. But obviously, when you're looking at an annual general meeting, you're talking about a year that happened quite a while ago now. So we're looking at 2020 to 2021. So April 2020 to the end of March 2021. So our annual report is on the website. We've got some copies available here if people want them. But I just thought I'd highlight the highlights that are in that report. First of all, that we reached out to our communities and we heard from 1,570 people throughout that year, looking at their experience of health and social care. Obviously, we responded to the pandemic, providing information to 1,871 people during the worst of the COVID pandemic that year. We made a difference to care when we published 8 reports about the improvement people would like to see in health and social care services. And this made over 60 recommendations for improvement. When we make recommendations at Healthwatch, we follow up. We have a way, we talk back to the organisations that we've made recommendations to our reports. And where we might feel that there's something that we still need to do to support an organisation, we often use the powers that we've got within scrutiny and the Health and Wellbeing Board to raise the attention of anything that we have recommended that still hasn't been actioned. And finally, in health and care, working for you, the people of Nottingham and Nottinghamshire, we had 31 volunteers helping us to carry out our work, and in total they contributed 544 hours. During that year we employed 11 staff and we received £306,000 in funding from our 2 local authorities, which is government money that is provided for Healthwatch, distributed by the local authorities, to do our work. We can't actually do everything that we need to do on that amount of funding. It's a thing that every organisation, I'm sure, that's funded by the public purse struggles with, but we make really good use of that money, and you'll hear that from our treasurer in a moment. But we also look to earn commissioned income where we can use our expertise to support any number of issues related to health and social care. But I just thought I'd highlight some of our annual report, and you can read the full report online, as I mentioned. So, thank you to everybody who took the time to read the different papers. I'm now going to hand over to Ian Blair, who's the treasurer of Healthwatch Nottingham and Nottinghamshire, who's going to take us through the annual accounts and the appointment of our independent examiners. So I'll hand over to Ian.
Hello, Sarah. Hopefully you can hear me. The accounts that we're submitting today were agreed by the Board of Trustees at their meeting last week, and are now being submitted to the AGM for approval. The main point, I think, in these is that we have received a clear audit from our independent examiner, CA+. Going into the detail of the accounts, it shows that we're still in a reasonably healthy financial position. Our funds increased over the year by £57,000, primarily due to reduced levels of operation and changed methods of working due to COVID, the delays in recruiting to posts, and surplus on the extra commissioned work that Sarah just mentioned. As a result of this, the board agreed to use this underspending to fund one-off service developments in the current year. And if you look in some of our papers, you will see what these are. Allowing for all this, we now have £258,000 in unrestricted reserves. 180,000 of this is set aside to ensure the future sustainability of the organisation, and in particular to cover 3 months running costs should all our income sources cease. The remaining 77,000 is for short-term financing issues and to invest in future service developments as laid out in our business plan. Our balance sheet shows that our cash at the bank has increased due to this underspending, and in view of that, the board agreed during the year to open up additional bank accounts to protect our funds under the government's Financial Services Compensation Scheme. That's all I really want to say on the accounts as such, but in closing, I would like to acknowledge the continued support of my fellow board members and Jane and her staff in the management of the Healthwatch finances. And subject to that, I'd like to propose to the meeting that they accept the accounts and also that they reappoint CA Plus as our independent examiners for 2021-22.
Can we have a seconder for the acceptance of the accounts? Sue, thank you. Everybody in favour? Thank you very much. Thank you, Ian. So, thank you, Ian. The accounts have been approved. So do we move on to the appointment of our examiners? So obviously the next part of the agenda is that we appoint our independent examiners for 2021-22. And the proposal is that we continue with Community Accounting Plus. I'm going to propose that and get a seconder. Phil, and everybody agree? Yes. Yeah. Nodding, lots of nodding. Thank you very much, Ian. The next part of the agenda is the retirement and election of any board members. So the first thing that I'm going to have to do is hand over to somebody else, as my position as chair is a selected position, as I am a remunerated chair at Healthwatch Nottingham and Nottinghamshire. So I'm going to hand over to one of our trustees, Sue Tribe, who's going to take this part of the meeting. Only for a minute, but I'll hand over to Sue.
Definitely only for a minute. Earlier this year, the board agreed to further extend Sarah's role as chair, as she said it's due to end today. And I'm proposing at this AGM today to extend it for 2 years, and I'm asking for a seconder. Thank you. And can I ask for ratification from AGM today? Yeah, okay. I'm going to hand back over to Sarah now.
It's one of those things, very nervous moment for me. They could have said no, and what would have happened then? Okay, so in every AGM we have a number of trustees that would normally retire, and this year we have 3 retirements from our board. The people that are retiring today are Claire Gollin, over here, who's been an amazing member of the board, supporting us around our HR particularly, but also really getting involved in the business of the organisation. Matthew Goodwin Freeman, who unfortunately can't be with us in person today. Matthew joined us 3 years ago now, I think it was, and very much championed young people on the board. And has been really influential in shaping our thinking about how we engage with young people and bring the voices of young people to the table. And one of Matthew's last things as a board member was to propose that we start to look very strongly for other active young people to come and join our board. And young people from a charity perspective is from the age of 16 to 24. That takes into account people with disabilities or special educational needs, that you take the age limit to 24 for people who are therefore seen as young. So we're very pleased that we passed that approach, and Matthew has been an incredible support to us. He was a student here at Nottingham Trent, Nottingham University? Yeah, Nottingham University. I'm looking to Jane because she knows more of the detail. And obviously went through COVID where he was working from home as well as working with us on Healthwatch. So thank you to Matthew. And the final resignation this time is from Dr. Ajanta Vis Biswas, who has been the Vice Chair of Healthwatch Nottingham and Nottinghamshire for the last 3 years. And as you've heard, some of the incredible work that Ajanta's done working with Platform 1, the health scrutiny panels in Nottingham City, and most lately on the NUH maternity issues in scrutiny around with both city and county health scrutiny panels. So a massive thank you to those three, particularly Claire, who's here in the room. It's a fantastic amount of work that volunteer board members do. We can't be an organisation without a board. And the amount of work and dedication that they've shown has really been a testament to how important I think Healthwatch is and is becoming when we get such amazing calibre people who want to work with us. So again, I'm going to reiterate the call to action that we're looking for new board members. We've got a number of places available, so please look at our website. We've got no co-options to ratify this annual general meeting. So in that sense, we're looking for new people, so have a think about it. And that would normally be where we would be bringing new people in at an AGM and bringing them into the organisation fully. So this is, we've looked at our minutes, we've looked at our accounts, we've looked at our annual report. So the last thing left for us to do is to ask if there's any other business from our board members. No. Any questions from the floor? Unfortunately, those of you watching online aren't able to ask questions at this point, but is there anything that anybody would need to ask from us? No. Well, that's the end. It's always very short, this bit, after what has been a really exciting afternoon listening to what we've been doing. So I want to thank you for your commitment to staying, those of you that have stayed with us online and in the room. And a massive thank you to the rest of our board. Ian, unfortunately, who can't hear us now because his IT's failed. But a massive thank you to Phil, who has been one of the most stalwart members of the board, helping steer through our finance subgroup and is now our company secretary. So thank you so much, Phil. And to Sue Tribe, who sits on our safeguarding boards as a representative for us, and our HR subgroup along with Claire. So thank you so much for all the work that you've done in this last year. So that's the end of today's activities. I want to say a massive thank you to Jane and Leanne, who have been our interpreters this afternoon, and again to our technical support and the rest of the team. You've done a fantastic job, and I hope you've enjoyed this afternoon. So thank you very much, and that's the end of our event. Thank you.